Hey, we're here at Alex today, and you had some neuromuscular dentistry done with Dr. Tamura.
Mm-hmm.
What were the symptoms that you had prior to seeing Dr. Tamura?
When I came in to see Dr. Tamura, my ear was sort of popping. I felt like my ear was a little closed off. I had jaw pain, tightening, sort of tension in the right side of my face. My eyelid was slightly drooping because of muscle tension in my face. A little bit of headache from like the forehead muscles being tight. And it was harder to chew, on the right side of my face. So I came in to see the doctor.
And how about neck pain? Did you have neck pain?
I did. I did have a bit of neck pain on my right side also. That was tied into the whole jaw muscle issue. But yeah, neck pain, and actually shut down sort of halfway through my arm. And
I remember that.
Yeah.
I remember that. And shoulder.
And shoulder. Yeah.
Right. Yeah. But your left side, you didn't have really anything.
Was fine. Yeah, was fine. And I sort of noticed like my right side, even when I walked, there was sort of I favored my right side slightly because it all sort of stemming from the right side jaw.
And so Dr. Tamura hooked you up to the K7 computer system. Do you remember that? When we looked at the EMGs and...
I do.
Yeah. Do you remember when you bit on your natural teeth, what the EMGs looked like when the muscle activity?
Yeah, it looked like a 10 on the Richter scale. the waveform pattern was very
off the charts.
Off the charts, yeah.
Yeah, and that's an indication that the muscles were spasming, and that's where a lot of your pain was coming from.
Exactly.
Right. Okay, so then Dr. Tamura made you a removable orthotic.
Yes.
And you've been wearing that. How long have you been wearing that?
Say around 3 months.
Okay. And how has it been feeling since you've been wearing that?
Amazing. Amazing. In fact, it's similar to the sensation I had coming off the TENS machine, where as soon as you pop it in, immediately all the muscles that had been aching before and have been tense before just slowly relax and release, and everything sort of comes into alignment. So it's almost immediate relief. Actually, I was shocked that, just by putting an orthotic in, that it would happen that rapidly, almost instantaneous. You get that feeling of relief.
And tell me about what you were saying earlier about when you take it out.
The same thing when you take it out. It's almost as immediate. The symptoms that I was used to before immediately return, and I can't go 5 minutes with it out without going back to that same feeling where you can start to feel the muscles pull and everything sort of getting back to where it had been prior to the corrective orthotic.
And so, how about how much do you wear it in a day, average?
I wear it overnight, always. In a day, it varies, probably 6-7 hours a day, between meals, generally, as much as I can. There are some times where I take it out or I'm eating throughout the day that it comes out, but once you've had it in and you know sort of what it does, I'm always, waiting to throw it back in because, like I said, you don't have to go 20 minutes without getting sort of out of alignment. So you kind of want to have it in. It's a sense of relief, and it's great.
Okay. And how about speaking with it in? Do you feel like that affects your speech? Do you think you've gotten better with that over time?
Yeah, when you first pop it in, it does, but I think your mouth just sort of over time learns to speak with it in. So when I first put it in, there was a little learning curve there, a few days maybe, but once you've had it in a week or two, you sort of learn to speak with it in. It doesn't really become that much of an issue.
Okay, great. And if someone had TMJ that you met, and they asked you what they should do, what would your advice be?
Let's say come see Dr. Tamura, and get on that TENS machine. And
what does the TENS machine do?
Well, it I don't know, you can help me out with that. It stimulates your muscles, and basically opens and contracts the muscles to their sort of back to their natural state of expansion and contraction, to where once they're fully relaxed and you bite down, they're sort of back to their original, the way they hold your muscle naturally, your jaw naturally in place. So by relaxing those muscles, you're able to determine what your natural bite should be.
Where the jaw should go.
Where the jaw should go naturally.
Right. So someone comes to you and they're in pain. Would you suggest an analysis with the K7 to see what their muscles are doing?
Absolutely.
Right.
Because it will tell you exactly diagnostically what's happening, what muscles are doing what, and you can craft treatment based on that.
That's exactly right. Any other advice for people who've got TMJ that you can think of?
I would say, get it diagnosed, check it out, because, for one, I thought it was many different things, my symptoms. I went to a back specialist, I went and got a CAT scan. I couldn't figure out sort of why all these symptoms were happening.
Didn't you go to an ENT?
Yeah, an ENT, because, my eye was having issues, and I didn't realize until I came here that it was all sort of tied to this one issue, and by correcting it, all those issues kind of went away. So that was great.
Right. So your bite was causing your jaw to go to a place that was causing the muscles to spasm.
Exactly.
Right. And by hooking up to the TENS machine, we could get your jaw muscles to relax, which allowed your jaw to go to a place where all the muscles were relaxed, and then we could make an orthotic that would hold you there.
Exactly.
Yeah. That's
very
great.
Happy.
That's good.
Yeah.
Okay. Thank you so much. I appreciate you spending time with us today.
All right.
All right. Take care. Bye.